What's going on, guys? Welcome back to W.D.Y.D. CSP. What do you do as a central sterile processor? Guys, we're going back to basics in prep and pack with retractors. All right, guys, so Decon did a fantastic job in cleaning your instruments and sending them through, but guess what? I pick up this one retractor and I see that there's some inserts in there. Now, again, these inserts can be reusable and others are one-time use. First, you need to identify that, right? Well, the bad thing about this is that the inserts came on the retractor. So automatically, this retractor would be sent back for processing in a tray that it came in with. Would be sent back to be recleaned, okay? These should be removed in decon. And if they are able to be reprocessed, okay, they should be cleaned separately, guys. All right. Now, these things get pretty nasty, and I'm not sure if they have a limitation for use. I do know, I can tell you right now that these specific ones are reprocessable, but our policy in our hospital is that we replace them every single time. So when they come through, we take them off, send the retractor and the tray that it came in back to decon to get reprocessed. All right. So make sure that you understand your policies and procedures and that you're following the IFUs of the actual device. All right. So assuming everything came back beautifully and nice and clean. All right. We're over in the prep and pack side and we're about to do our visual inspection. Now, I'm not going to do every single one of these, guys. You would have to know how to inspect your instrumentation on your own, but I'm just going to grab one random, and this is a self-retaining retractor. All right. So first off, identification. You want to make sure that is the correct instrument, because these are two of the same instruments, right? Different sizes, but the other difference is that this is a blunt tip, and these are sharps, right? So make sure that you're grabbing the correct instrument for the tray that you're going to process. And when you're inspecting your instrument, again, guys, your handy dandy lighted magnification, okay? And you want to inspect in between those jaws, okay? The working end should be the first end that you inspect, because usually that's the dirtiest, right? So you want to look in between those jaws, because if they didn't brush well between those jaws and those teeth, there's going to be some soil stuck in there, right? So you want to make sure that that's nice and clean. You want to pass by on the instrument, get to this box lock, make sure that there's no cracks. And guess what? There's a screw here, right? So you want to make sure that that screw is not backing out like that. See that, guys? You see that? Okay, that's a bad thing. That usually happens if that pin isn't set correctly, or it can happen when you place it into the ultrasonic. This is one of the things you want to look for immediately in the prep and pack side after you inspect your jaws, right? Look for that screw. Make sure that screw is set nice and flush, like so, on both sides, right? You don't want that screw backing out, because if you send this device up like so, and surgeon is manipulating and he doesn't notice it, that screw can actually back out, fall into the patient. Not necessarily the device will come apart, not immediately, but if it is holding on to a patient, it's retracted in a patient, and he goes to retract it and that screw isn't there, that instrument's gonna pop right apart, right? And you're gonna have a extremely pissed surgeon. And we don't want to piss them off, right? We want to make their job easier, right? So inspect that screw. Okay, the next thing you want to go ahead is you want to inspect the spring mechanism, right? So this should spring back. If it stays in a down position, you may have to lubricate it, or take a look at that spring, right? There's another screw right there. Make sure that screw is set tight and that the spring action there's no crack in there. If there's a crack, or this has excessive wear, then it may not give it enough spring action to close this instrument or hold it in the open position. So with your self-retaining retractors, that's important that you're looking at all those screws, right? Anything with a screw in there, you want to make sure that you're manipulating it, that it's smooth, that the ridges on the screw, like this one has a screw in open and close. So you want to look at the threads in there to make sure that there's no soil in there. Right in that joint, make sure that there's no soil in that joint. Get that magnification in there. Don't be afraid to use the magnifier, guys. If you don't know how to use it, practice. Practice makes perfect. So you want to get in there, look at that jaw, look at the threads on that screw, make sure that there's no soil built up in there, and that any screws that you have are flush on that instrument. What about these solid instruments? They're pretty basic, right? Well, you want to make sure that they're not bent all crazy, right? So this is a retractor that may have a slight bend in it, but you want to make sure that there's no pitting or any severe scratches or sharp edges. Okay, they should be nice and smooth around the edges. You want to make sure that there's no gouges or it wasn't hit with a hammer or a chisel and it has a sharp edge on there. It's not designed to have a sharp edge. For this specific retractor, it doesn't. Some of them, it may look like this and they do have like little teeth in the end. That's normal. But if it's not designed to have teeth or ridges, they shouldn't be creating them, right? So run your hands down that instrument. Make sure that there's no sharp edges in there. Get your lighted magnification to look for any pitting, any rusting, any outstanding stains. Okay, I can tell you like this instrument right here, this one been through the fire, right? So this one got all kinds of scratches and gouges. Like I wish you can see this on the, actually you probably can see that on the screen. See that right there? Okay, the coating, the chrome plating is coming off on this instrument. So this is a bad instrument, right? You don't want to send this back onto the field. All right, and then inside here, right in the grooves, you can see where the plating is worn out really bad. Right here on the handles, you can see where it's really worn. And some of the welds look like it's coming apart here. So this is definitely an instrument that you don't want to send back out in the field. This is actually unrepairable and really should be replaced, okay? Your retractors that come apart, again, read the IFUs if you're supposed to reassemble them so that they can go into the set. So if you can reassemble them for sterilization, then you should reassemble them. If they're supposed to stay disassembled for sterilization, then again, follow that IFU. Okay, I've had, little story, I've had so many encounters in my career where facilities actually want you to assemble the retractors for sterilization, but the IFUs clearly state to disassemble for sterilization. And again, because of that should, you know, the hospital policy overrides what the IFU says because of that should in there, you know, and they'll do their own risk assessment or whatever they do to make it, to deem it that it needs to be assembled for sterilization because they don't have time in the field to assemble it. Whatever the case may be. All right, but if it can be assembled for sterilization, assemble it. Make sure that it works, okay? So you should be assembling it on the prep and pack side anyway to make sure and test the function of it to make sure that it works. And then if it can't be assembled for sterilization, you should be disassembling it again for sterilization. All right, again, guys. That is the basics with prep and pack is inspect for cleanliness. Make sure you're picking up the right instruments. And again, look at the markings on it, all right? These all have markings on it. And I always bring out these two instruments for a reason, right? So these are two instruments that are always often confused, right? The Sen retractor and the Matthias, okay? Or the Matthews, right? I always say it wrong. I don't know which one it is. But I always tell people the way you identify these two instruments in the prep and pack side is that one of them can do men push-ups on their toes and the other one do the girl push-ups on their knees, right? So that's how these instruments are kind of identified one from the other. So I don't know if you guys can see this on the screen, but the curvature of the jaw and the foot is the same direction. And for the Sen retractor is opposite. The jaw goes to one end, the foot goes to the other, right? So that's how you tell these instruments apart, guys. But just a little identification there for you. Well, guys, that's all I have for you. As always, stay true to yourselves. Keep it 100. Continue educating yourselves. And until next time, peace.